Hi, Mitch here again. This is my third topic. I decided to do my next video on ringing in the ears, possibly leading to hearing loss. I found a possible and partial remedy. This subject was asked of me several times in my pharmacy practice before retiring. Mitch, what causes ringing in the ears and how do I remedy the problem? Until recently, I was at a loss for a meaningful explanation. Tinnitus, ringing in the ears, affects about 15 to 20% of Americans, especially older adults. Tinnitus with hearing loss can be caused by ear injury, infection, constant stress, and constant high decibel sounds of noise. There are hair cells in your inner ears which communicate with the auditory nerve in the brain. If these hair cells are damaged due to accident, infection, constant loud sounds, and cortisol and adrenaline-induced stress, the auditory nerve pathway of the brain becomes chronically inflamed. Chronic inflammation anywhere in the body or brain is the pathway to disease. And that's a fact. So if you have constant chronic inflammation anywhere in your body, most likely someday you will develop some form of a disease. It's the immune system destroyer. Tinnitus and hearing loss become the disease. Many times we are quick to blame ear wax buildup for this problem. This many times is not the case. I repeat, many times is not the case. In fact, we can cause an infection in the ear canal that leads to cellulitis via staph, where bacteria enter a break in the skin caused by the intense picking of the ear canal with ear swabs or anything else you're using. These infecting bacteria can infect the deeper layers of the ear canal. This problem alone can cause ear loss and tinnitus. My point here is that we tend to look for simple answers, but many times this is not the case. Recently I came across a machine, a cranial electrotherapy stimulator, or C.E.S. machine. I found this machine using Google search. This machine is an alternate therapy to symptomatic medication used for insomnia, anxiety, and depression and vagus nerve stimulation. This device, with attached ear clips to the earlobes of the tragus, which is a part of the ears, helps to modulate the brainstem. This device increases the parasympathetic drive in the autonomic nervous system via vagus nerve stimulation. What this means in simple terms, by decreasing the stress, cortisol, and adrenaline pathways, the device decreases insomnia, anxiety, and depression. We are creating an electrical balance in the brain, so if tinnitus is caused by an inflamed auditory pathway in the brain, we are decreasing the incidence and inflammation via stimulation of the vagus nerve. Even more interesting about this machine is by stimulating the vagus nerve, the result is stimulation of both the parasympathetic autonomic pathway and the chemical acetylcholine in the brain. Stimulating acetylcholine causes better communication between nerve cells in the brain. That's right. The brain can conduct more appropriately and easily with an increase in acetylcholine. This concept is how physicians treat the symptoms of Alzheimer's patients with Alzheimer's medication. Note, I said the symptoms of Alzheimer's, not the cure. The degeneration still continues. So maybe, just maybe, besides the amyloid plaque on the brain as a cause of, Alzheimer's, this inflammation of the auditory pathway should be addressed with the help of the cranial electrical stimulation machine, or C.E.S. I have been using this machine for 2 hours a day for about 3 weeks and have noticed a decrease in my right ear tinnitus and less hearing issues in the right ear. I promise I am not shilling this C.E.S. device, or am I affiliated with it. I bought the C.E.S. Max 2 by Zen of Sleep just to aid in this issue that I have. Thank you for listening to my video. Again, I appreciate your time sitting through it. Please give me a thumbs up and subscribe to my channel. Mitch the Retired Pharmacist, signing out.